I'm Dr. Jha, Director of Renewed Skin and Health Clinic in Royal Leamington Spa. Today I'm meeting Mr. Dan Higman, who is a consultant, general surgeon as well as pediatric and vascular surgeon in University Hospital of Coventry. Hello, Mr. Higman. Today I'm interviewing Mr. Higman, and we will talk about varicose veins and thread veins. What are varicose veins, Mr. Higman?
Well, a varicose vein is a dilated, tortuous, superficial vein in the leg. So they're under the skin. They're the ones that you can see as bulging veins in the legs.
Mm-hmm, mm-hmm. And what are the complications of these veins if they are left untreated?
Well, in about 10% of patients, and it's a relative minority of patients, they can go on to get complications. The types of complications we see are things like phlebitis, which is where the vein becomes hard and tender and sore for several weeks. And then the patients can develop skin changes around the ankle, so they can get pigmentation, eczema, and ultimately ulceration.
Really?
But that is in probably about 10% of patients with varicose veins.
And is that ulcer, when they develop, is it easy to treat, or is it difficult, or is it a challenge?
In the majority of patients, it shouldn't be too difficult to treat in terms of if you can identify the underlying varicose vein problem or venous problem, then the treatments should be successful. In about 70% of patients can be cured within about 12 weeks of starting treatment for varicose veins.
So in other words, you're saying that the person has to be treated for their varicose veins first before the wound heals.
If they have got varicose veins, and that is a major contributor to their ulcer, then the varicose veins certainly should be treated to get healing. Some patients with leg ulcers, it's the deep veins which are the problem, in which case the varicose vein treatment won't have a benefit, but for those patients with varicose veins, certainly treating their varicose veins will help them heal their ulceration.
And how do they start these varicose ulcers?
Well, the first sign that the patient is developing complications of varicose veins will be some eczema or pigmentation around the ankle area, normally on the inside of the ankle, and sort of 6 inches above the ankle bone. That's where they'll see it, and that comes on over several weeks or months. So ulceration will happen not overnight, but it'll be a gradual development over a period of time following these skin changes.
And are there any further risk of such as cancers and stuff like that?
It's incredibly rare. If you've got a very, very long-standing venous ulcer, then a minority of those patients will develop a skin tumour in those so-called Marjolin's ulcer, but that's an incredibly rare thing.
Okay. And what are these thread veins? Tell me about thread veins.
So thread veins are quite different from varicose veins, and they're unrelated to them. These are minute dilated veins within the skin, so they're in the skin as opposed to varicose veins under the skin. They're dilated, they're just visible veins occurring usually on the legs, but you can get them on other places in the body. And
how do you treat these thread veins?
The treatment for thread veins is centered around, if you can get the blood in these little tiny veins to clot, then the body will then break the clot down and obliterate the vein so you can't see it anymore. That's how all thread vein treatments that work function. There are the two ways of getting the blood to clot. You can either shine light at them and heat the blood up, that's how laser and photodome works,
right.
Or you can use micro-injections to cause the vein to clot that way.
All right. And how do you treat the varicose veins?
In terms of treating varicose veins, there are really 3 main treatments available. You can either use surgery, which is the conventional treatment, which actually removes the varicose veins. That, of course, involves a general anaesthetic usually and some incisions on the legs. The second way of treating it is you can use a foam sclerotherapy, it's called. That's under local anaesthetic. Patient lies down with the leg in the air, and on a small injection into the leg of a foam which irritates the inside of the vein and causes it to become sticky, and then you bandage the leg for a week and that sticks the vein together. So it doesn't remove it, but it closes it off.
So you apply the compression there after the procedure?
Exactly.
To become it collapse, the veins collapse?
Exactly.
Yeah, yeah.
The third way of treating varicose veins is to use, again under local anaesthetic, so no need for a patient to go to sleep, a small catheter a little tube is injected, is threaded into the vein, and then the vein is then sealed from the inside using either microwave or laser. It's just sealed it by heating the inside of the vein, and that will close it off in a similar way to how the foam sclerotherapy works.
And is there a difference between the treatment that you plan for somebody who has got a very long history of varicose veins, or somebody who's just last a couple of months or 6 months?
I don't think it makes a difference how long the patient has had varicose veins. The critical thing is to look at where the patient's varicose veins are, and identify clearly where the origin of the veins comes from. Because if it is a long vein all the way from the top of the leg to the bottom, the valves are not working, then you might choose one treatment, rather than if there's just a small section of varicose vein, you might use a different treatment. So the key thing is to very clearly diagnose the site of the varicose veins in patients.
Sure.
And choose the treatment accordingly.
Good. And how successful are these treatments?
In terms of varicose veins, about 70% of people who get treatment for varicose veins are cured. And really all the 3 treatments work pretty effectively, really. The key thing is choosing the correct treatment for the correct patient, and that's the key to success. About 30% of patients who have varicose vein treatment will at some point in their life go on to develop further varicose veins. It's not the varicose veins coming back, it's the normal veins in your leg have become varicose over the years as the sort of normal process of forming varicose veins. In terms of thread vein treatments, whether you use laser or whether you use injections, and you need to tailor that to the particular type of thread veins the patient has, the treatments can get rid of about 80% of thread veins, and most people find that as a substantial improvement, which will give them more confidence in putting shorts and skirts and things and exposing their legs. It's important to realise there's nothing that you can do to prevent thread veins or indeed varicose veins forming, and so people need to sort of recognise that whenever they have treatments, but they're very successful at dealing with what's there at the time.
And what are the cause of these thread veins or the varicose veins?
Well, interestingly enough, nobody really knows. I mean, the fact is that leg veins are really common. About 1 in 3 people have got some form of leg veins. But why some people get them and other people don't is really not clear. It's true to say that if you've got varicose veins, if you are overweight, if you're pregnant, if you spend a lot of time on your feet, your varicose veins will ache more and be more symptomatic. But it's not clear at all that those activities or being pregnant actually causes varicose veins in the first place. In the same way, there's no really good evidence that it's genetic and that you got them from your parents. Of course they're so common, and it's very likely that other members of your family will have them, but it's not really clear that it's a genetic thing. So the answer is nobody really knows why some people get them and some people don't. The same is true of thread veins.
Okay. Well, thank you very much, Mr. Higman, and thank you.